All right, antiparasitics, VTNE review, and final exam review. You made it, guys. This is the last one. So for fenbendazole, also called Panacur, which parasite does it control? This will control our nematodes, or our roundworms. So it does our large and small strongyles, our pinworms, roundworms, the bulk of those. Another cool thing about this one is this is used in rabbits to help treat E. caniculi. Although for rabbits, this is one that will have to be redosed on a pretty regular basis. How is it administered? This is administered in small animals as one packet for 3 days. So for each day, day 1, 2, and day 3, then we will put the medication into the packet and then administer it with their food. And usually we just mix their food with water and dump the packet in and make it into a little slurry for them to eat. For horses, this is given by mouth via a multi-dose syringe. Remember that while horses can't vomit, horses are really, really good at spitting this stuff out. For what form does it come in? And for small animals, this comes as granules. And we have a little paddle that we use to scoop it, and it's based on body weight. So usually it's like 5, 10 pounds, 15 pounds, and then usually there's a 25-pound as well. And so we just add those up to whatever the animal's body weight would be. For equine, it comes as a paste dewormer as a multi-dose syringe. And so we're going to dial the syringe to the appropriate body weight for the horse. What does it look like? Looks like white granules or as a paste. For pyrantel, pamoate, Strongid, also called Neme, this is going to control our ascarids. So again, roundworms again, our strongyles, our pinworms, and our hookworms. And what does it look like? It looks like a yellow liquid, and often we'll call it banana pudding around the veterinary hospitals. To me, it does not taste like bananas, but oh well, it makes the owners feel better, right? Ivermectin, which is Heartguard or Ivomec. This will control heartworm, so prevents Dirofilaria immitis. And it will also control multiple other types of parasites like our mites and things like that. This is often going to be approved for our cattle and swine, although there are some small animal formulations that have been approved. Species and breeds that are sensitive. These are going to be collie dogs that are going to be the most sensitive. They are going to lack a gene, and it means that it can affect their brain pretty significantly, and they can be neurological. Australian Shepherds, Border Collies, collies like Lassie are all very sensitive to this. And then how can they have exposure to this drug? If we don't give this dog the heartworm medication, how are we giving them the ivermectin accidentally? And the way that this works is often in equine feces after we have dewormed. So it's going to be really important for us to make sure that the owners are keeping these types of dogs away from the medication. And remember, client education is one of the best things that we can do. For moxidectin, also called Proheart, it comes in 2 formats, Proheart 6 and Proheart 12. Parasites that it controls, this is going to control Dirofilaria immitis and the microfilaria that will turn into the adult heartworm. And then existing hookworm infections, and this is only for Proheart 12. So Proheart 6 has not been approved for this, but Proheart 12 has been. But it's only for existing infections. This isn't going to help to control future infections at all. And the frequency that this is administered, depending on which format we're giving, either 6 months or 12 months, depending on the formula. Praziquantel, also called Droncit. The parasites that this controls will be our tapeworms, also called cestodes. This is one that we very frequently will mix up with other drugs as well. Like Droncit Plus is one that will take care of multiple parasites. So Droncit is one of those that will be a cesticide or kill the cestodes. How do we prevent reinfection? This one isn't on some of your flashcards, but this is a future flashcard question. And preventing reinfection, we've got to control the fleas. Otherwise, the fleas will reinfect the cat or dog with tapeworms, and we'll go through this all over again. So controlling the fleas is going to be key to helping control tapeworms after we have treated. Sulfadimethoxine, which is also called Albon. The parasites that this controls is Coccidia. This actually also does have some antibacterial properties, but mainly we're using this for Coccidia. And the species that we use this in, dogs, cats, rats, chickens, there are multiple species that we can use this for. Our melarsomine dihydrochloride, also called Immiticide. This is going to help to control Dirofilaria immitis. We give this IM intramuscularly in the epaxial muscles. This is a very deep and painful injection. And special requirements for this, we will also need to be giving doxycycline concurrently for the bacteria Wolbachia. And then we'll need to do cage rest for 6 to 8 weeks after the last injection. Many times this is a 2 injection type procedure, but there are other protocols with additional injections as well. Selamectin, also called Revolution. The parasites that this controls, this will control fleas, ticks, heartworm, roundworm, hookworms, and some mites. This is one that can be used in some of our exotics. Think like hedgehogs. They might use the puppy kitten version for mites. Also rabbits. This can also be used to help control mites. Again, the puppy kitten version by weight. We have to be very careful with this though when we're working with it in exotics. Where and how is it administered? It is going to be a top spot between the shoulder blades. We're going to need to part the hair, usually with the end of the capsule, separate the hair, and we'll place it on the top. And how frequently is it administered? Once a month. This is going to get absorbed into the skin, so we want to prevent other animals from grooming each other. Fipronil, also called Frontline. This is going to help to control fleas, ticks, and chewing lice. You guys remember the name of the chewing louse from lab procedures? All right, I'll let you guys look that up. We'll talk about it in class. Where is it applied? This one is also going to be a top spot between the shoulder blades. Are there precautions after application? Yes, we do not want to bathe the animal with Frontline for 48 hours after. We do not want the cats to groom the dogs, dogs to groom the dogs, kids to play in this. We want to make sure that we let it apply and absorb into the body. And who should not get this drug? This drug is lethal in rabbits. So this is one we want to educate our owners not to ever administer fipronil to our rabbits, because usually 3 days later, rabbits are dead. So it's not something that you can wash off and save the rabbit. Typically, this is bad. All right, and then we have our olufenuron and milbemycin Sentinel. This is going to control heartworms, tapeworms. This is one of the only monthly medications that will control tapeworms, roundworms, hookworms, whipworms, and the olufenuron is going to help to prevent flea eggs from hatching, which is a pretty cool thing as well. This is oral once a month flavored tablets, so they're compounded to have the medication inside. And then last one, congrats, you've made it this far, is Amitraz, also called Mitaban. And you already have this flashcard from our behavioral drugs because Amitraz is considered a behavioral drug as well. This one is as a antiparasitic, was discontinued in 2018, but something you still could come across somewhere somehow. This will help to control mites. Typically Demodex, but in some cases it has been used for scabies in the past. What do we need to do before, for the patient before using this dip? We need to apply eye lube. This is something that needs to go all over the face, all over the surface area of the body. We don't want this to get inside the eyes though. Dips are concentrated. What does that mean? It means that we need to dilute these prior to use. And then the collars can be reversed with which drugs? This is going to be, we can reverse side effects from the collars like over sedation or bradycardia we can use our alpha-2 adrenergic antagonist to reverse this. So this would be yohimbine and atipamezole would be our most common ones used in small animal medicine. What do we need to do after the dip to protect our patient? We need to monitor them for hypothermia. Why? Because this drug can counteract some of their ability to regulate their body temperature. So we need to be very careful with that. All right, you guys, you have made it to the end. Good luck on your finals. Good luck on your VTNE, whatever you are using this for. Have a great time taking it.